There are a variety of causes of this vaginal discharge, and so these causes are categorized into physiological and pathological. So the physiological are said to be normal causes of vaginal discharge, while the pathological are the abnormal causes of vaginal discharge. So the aim of this video is to explain to you guys what vaginal discharge means and when to seek for an advice. Hey guys, you're welcome back to my YouTube channel. My name is Dr. Cynthia, and today we'll be diving on a topic that is very common among women but isn't openly discussed, and that is vaginal discharge. So vaginal discharge is a fluid that usually comes out from the vagina, and it plays an essential role in a woman's health. And there are a variety of causes of this vaginal discharge, and so these causes are categorized into physiological and pathological. So the physiological are said to be normal causes of vaginal discharge, while the pathological are the abnormal causes of vaginal discharge. So the aim of this video is to explain to you guys what vaginal discharge means and when to seek for an advice. So first of all, I would like you to like, share and subscribe to my YouTube channel. So for the physiological causes of vaginal discharge, there is pregnancy. Pregnancy is a possible cause of vaginal discharge. Yeah, so during pregnancy, it is natural for you to experience vaginal discharge, and this vaginal discharge that occurs during pregnancy is as a result of increase in the hormone estrogen in the body and also increased blood flow to the pelvic area. And what this vaginal discharge does during pregnancy is that it helps to keep the vaginal area clean. So the discharge that occurs during this period is usually thin, milky, with a mild smell, and it does not cause any itching or any discomfort. The second cause of normal vaginal discharge is the pre-ovulatory period, and this is as a result of increase in the hormone estrogen in the body. And during this period, the body is actually preparing for the fertile phase of the menstrual cycle, and the discharge that occurs during this period is usually clear and stretchy. The third causes of normal vaginal discharge is the premenstrual period. This period is before the normal menstrual period and is as a result of increased level of progesterone in the body, causing vaginal discharge. And the vaginal discharge that occurs during this period is usually thick, cloudy or white. It's a normal fluctuation that occurs during normal menstrual cycle. And then the fourth cause of normal vaginal discharge is sexual excitement. During arousal, there's increased blood flow to the pelvic area, resulting in more lubrication. The fluid that occurs during this period is usually clear and odorless. It helps to prepare the body for intimacy. And then there are other possible causes of physiological discharge. And now let's talk about the abnormal vaginal discharge, which is also referred to as a pathological vaginal discharge. And this discharge can cause itching, discomfort, and even have a foul smell. So you shouldn't joke with this kind of vaginal discharge. If you have this kind of vaginal discharge, you should seek for medical advice. The pathological causes of vaginal discharge on my list is yeast infection. Yeast infection, of course, is very common among females, and in yeast infection there is intense itching and discomfort in the vagina and around the vulva area. And then the vaginal discharge is usually white and thick, and it has a cheese-like appearance. So if you have this kind of itching, please seek for medical advice. The second on my list is bacterial vaginosis. Bacterial vaginosis is a common infection also, and is as a result of an overgrowth of a particular bacteria in the vagina, leading to imbalance of bacteria in the vagina. The discharge in bacterial vaginosis is usually off-white or gray and usually have a fish-like odor. Yeah, I repeat, a fish-like odor. So if you have this particular vaginal discharge, please seek for a medical advice. Please seek for a medical advice. And the number 3 on my list is sexually transmitted infection, which is the STIs like chlamydia, gonorrhea, trichomoniasis. And the discharge is usually yellowish or greenish, and they are accompanied by other symptoms. Please, if you have this particular kind of discharge, please see an healthcare provider for further screening or tests. There are other causes of abnormal vaginal discharge like malignancy. There are some rare cases where unusual vaginal discharge is as a result of malignancy. For example, there's vulvar cancer, there's vaginal cancer, and then there are other kind of cancer like choriocarcinoma can cause an abnormal vaginal discharge. And other causes of abnormal vaginal discharge is insertion of foreign body into the vagina and should be avoided. So remember, vaginal discharge is a normal part of life. So it is helpful for you to know what is said to be normal and what will require a medical attention. So if you notice any unusual odor, color, or discomfort, please consult an healthcare provider. It's not something that you should be ashamed of. So guys, thank you for watching. If you like this video, please give it a thumb up. Don't forget to subscribe to my YouTube channel, like my video, and share, because this video might be helpful to someone out there. Thank you guys.